I'm Gareth Goodier, Chief Executive of Melbourne Health. I've been a Chief Executive for over 25 years, and probably 17 plus of those have been in academic medical centres of some form or another. Melbourne Health consists of three elements. Royal Melbourne Hospital on two sites, NorthWestern Mental Health Service, one of Australia's largest mental health services, which is on about 30 sites, and a cluster of organisations within the Doherty Institute, a joint venture between Melbourne Health and the University of Melbourne, which are to do with infectious diseases and immunities. One of the goals that I was set when I arrived was to try and make more of the parts that exist within this suburb of Parkville. There are 4 hospitals here and then 4 medical research institutes. I think it was fair to say that they weren't working as a partnership 5-7 years ago as much as they are today. So I think one of the achievements in recent years has been a much more cohesive approach to working together across a number of issues. And the prime example of that working together would be the establishment of Melbourne Genomics Health Alliance. I think any partnership, for it to be successful, has to be based upon trust. It's really about building the trust by meeting fairly frequently and getting to know the leadership teams across the various partnerships. I think it's true to say that wherever you are in the world, if you're running the larger organisation in a group of organisations, there are anxieties from the smaller organisations that they are going to be taken over or their brand will be diluted and so on. And I think the most important thing to the smaller organisations is, in fact, that they have their place in the sun, that they retain their brand, and that they are allowed to flourish. One of our other successes, other than Melbourne Genomics, has been a working together to identify ways to facilitate clinical trials with much faster ethics and research governance approval. Going forward, one of the challenges is, of course, to link with our community partners. And at the moment, Melbourne Health has a very good collaborative going with the primary care network and the 2 community providers within our own immediate catchment. But looking at a broader system approach, that again adds a level of complexity that we haven't yet addressed. I see one of the challenges going forward is not only having much better health informatics so that we can not only take EMRs from the hospitals and the GP systems, but also the Fitbits and Jawbones and iPhones from the individuals, and monitoring devices for chronic diseases where appropriate. Bringing that together so that the whole community of providers can see what everybody is doing and how it works together. I'm particularly interested in trying to bring in private health insurance and telecoms to work on trying to discover how that is best done. Finally, the other benefit that comes from a partnership and a system partnership is the ability to do service redesign and to be able to start to centralise where it's appropriate to have a very specialised care. And a good example of that would be the work that we've done at Royal Melbourne Hospital to demonstrate in large vessel occlusion stroke that interventional neuroradiology is the way to go. And that means you need a centre that does 24/7 interventional neuroradiology, and there aren't too many of those in Melbourne. So we are the first in the state to be recognised as a comprehensive stroke centre, and I think the way that the state will go forward is having 2 of those centres. When I look at international developments, I look at partnerships in some countries where they are seeking some expertise, and particularly with China. In Melbourne Health, we have about 5 MOUs with all sorts of cities, Beijing, Nanjing, Shanghai, Tianjin, and so on, where we are developing, in some cases, really quite deep and meaningful relationships where they will send 10 staff at a time to spend 3 months with us to take back skills and learnings to their own hospitals and centres. Similarly, ICHOM, where you follow a particular pathway with particular outcomes, and necessarily you are learning as you have that conversation with similar partner hospitals in other countries. So it's true to say that the Australian economy, in terms of continuous years of growth, has done much better than most in the OECD. But the Australian economy is heavily tied to the Chinese economy, and therefore, as the GDP growth in China has gone down a little bit, so I think in the public sector in Australia, it is getting tighter and tighter. Some work that I really started in Cambridge University hospitals, which I've carried on here, is to have very accurate, detailed business intelligence support for the management. And by that I mean a profit and loss on every patient. I mean, you know, the cost per patient divided by all the elements. Because clearly, in everywhere I've looked over a long period of time now, there is a 2 to 3-fold variation in the cost of care for the same type of patient, even something as simple as cataracts, and a lot of that is unnecessary clinical variation. So I think you take the 5 to 15 diagnoses, and then you start to look at the lengths of stay, costs, and so on of those, and benchmark them both nationally and internationally to see how you stand. And then you break it down to the level of the individual consultant, and so on. And you keep drilling and drilling, and you'll find enormous variation. If I was to look forward 5 to 10 years, what I would like us to see as doing here is to have the ready informatics and electronic systems, not only within the hospitals, but within the general practice and at an individual level, and to be able to capture all of that information so that A, we can do more detailed research on patient care and how to achieve optimum care, but also that we're all aware of the results and diagnostic tests and outcomes that each consultation has led to. Having achieved that sort of level of sophisticated informatic infrastructure, I think then the fun is to really drive an understanding of how you keep people healthy. And of course you add to that the genomic information that we're focusing on in this area, so that really you're getting to understand the individual as an individual.